committee to investigate allegations of illegal organ trafficking at the Mediheal group of hospitals. The committee, to be led by Professor Elizabeth Bukusi, is also expected to probe non-compliant tissue and organ transplant services offered within healthcare facilities in the country. The appointment comes even as Mediheal founder Swarrup Mishra denied allegations that his facility had been involved in organ trafficking. Here's Gatete Njoroge.
A week after announcing a fresh probe into allegations of organ trafficking at Mediheal group of hospitals, Health Cabinet Secretary Aden has appointed a 13-member committee that will oversee the process, expected to be complete within 3 months. A Gazette notice by CS Duale indicates that Professor Elizabeth Bukusi will chair the Independent Investigative Committee on Tissue and Organ Transplant Services, which brings together medical practitioners, scholars and regulatory bodies. The team has been directed to, among other things, investigate allegations of illegal organ transplant and organ trafficking at Mediheal. By talking to medical professionals involved in the process, donors and recipients over the last 5 years, the team is expected to determine whether there were instances of commercialization, coercion, organ trafficking, or violations of the Human Tissue Act. Their mandate will also include probing all facilities offering transplant services to establish the status of compliance.
We will take appropriate action.
But even as the health CS puts his best foot forward to deal with a challenge that is a source of sleepless nights to hundreds of families in Uasin Gishu County, the hospital on the spot continues to claim nothing is amiss. Mediheal group of hospitals founder Swarrup Mishra says the allegations are unfounded and that he will fight them off through the second public audit.
We are not involved in any trafficking. We are not involved in any syndication, syndicate, and we are not involved in any criminal enterprise related to the issues of kidney transplants.
The hospital, which puts the number of transplants conducted over the last 7 years at 476, says out of this number, 105 were foreigners and has denied findings of a 2023 probe that there was no translation, despite cases of donors and recipients being of different nationalities.
In the affidavits to the donors, we have made sure that they confirm that they have understood the legal provisions that exist in relation to donation, and we've made sure also that it indicates that they have the liberty and the choice to withdraw even at the last minute before their life.
On the findings that transplants were conducted despite poor HLA donor recipients cross-match results, Mishra says they used high technology and ensured that those who received their kidneys did not have any reactions.
We did the level 4. That is not only cross-matching, HLA typing, but genetic mapping. So gene to gene, so rejection is 0.
We have no cases reported to us of any complications either in terms of the donors or in terms of the recipients.
Mishra insists that the facility, which charges between 4.5 and 3.2 million shillings, did not offer donors cash to give their kidneys, as alleged by some of the victims. Gatete Njoroge, Citizen TV.